Internationalizing curriculum through COIL. With the pandemic restricting international travel, many universities are seeking new and innovative ways to continue international education. New program types have been developed to introduce students to cross-cultural learning opportunities and to help them reach global learning outcomes, such as virtual coursework at international universities, virtual internships and volunteer work, and glocal programs in which global themes are explored in a local context. The focus of international education has shifted to moving minds instead of bodies. Physical travel will certainly be a component of international education once it is safe, but the concept of global learning has expanded to include all of these new types of programs. COIL is an innovative method of teaching and learning originally developed and promoted by the SUNY COIL Center in New York. It leverages online technologies to deliver global learning and intercultural experiences in the classroom. The COIL model expands global learning opportunities to a greater number of students. It is an innovative pedagogy involving collaborative teaching and learning in 2 or more countries facilitated by online communication. Faculty from U.S. institutions collaborate with counterparts at institutions abroad to develop a joint syllabus or course module, and students in the 2 countries then work together to complete assignments that meet shared learning objectives. A COIL experience is a lesson in academic content as well as intercultural communication and collaboration for students and faculty alike. Here is an example of the different ways COIL can be implemented into a course. Although the graphic shows that a module is 5 to 12 weeks, it can be any length that suits the collaborating faculty. Each participating faculty and their respective students may have their own assignments before or after the collaborative module with the foreign university. The possibilities of COIL are endless and can even be cross-disciplinary. Perhaps a professor of anatomy partners with an art history professor, and they explore the relationship of art and human anatomy in sculpture, paintings, and other art forms through history. Some other interesting topics may include structures of and access to healthcare in the U.S. versus another country, biases such as racism, sexism, and homophobia in healthcare, pandemic response, diet and nutrition education, mental health care availability, stigma and response, bilingualism and speech development, or care of the elderly. Any interested faculty will not shoulder the burden of the COIL initiative alone. International Affairs has a dedicated website specifically for faculty with resources and recommendations. Professional COIL trainings being offered through SUNY are free of charge through SDSU, and there are monetary incentives for faculty members as well. A group of SDSU faculty and staff, the SDSU COILers, has been established to facilitate communication, idea sharing, and support as COIL courses are developed at SDSU. The College of Health and Human Services also has an international programs coordinator who is available to support any CHHS faculty who is interested in adding a COIL component to their class. Do you think you might want to explore COIL further? Great! The first step would be to contact Adrian Fusick in International Affairs or Julie Dugan, the CHHS International Coordinator. You can also visit the International Affairs website for more information.